This patient is having a central jugular venous line placed ahead of a right ventricular pulmonary artery conduit replacement operation. This patient, a child, is anaesthetized in the supine position and is on positive pressure ventilation through an endotracheial tube. As the line is to be placed in the right internal jugular vein, the patient's head is turned slightly to the left, as seen here. Although the traditional landmarks are used to identify the location of the vein, the intended puncture site marked here has already been marked prior to filming with an ultrasound probe. Two layers of skin preparation are used. The first layer is chlorhexidine, followed by povidone iodine. The patient's neck is cleaned up to the jawline and the earlobe. And down to the chest and shoulders. Then a ring towel is placed over the cannulation site. The needle and guide wire are made ready. The needle is mounted onto a syringe partially filled with heparinized saline, and the coiled guide wire is placed close by. The sternal notch and the right carotid pulse are palpated. The internal jugular vein, and hence the marking, are located lateral to the carotid pulse. The beveled tip of the needle is set against the skin at a 45-degree angle and advanced a short distance in the direction of the left nipple. Once the needle tip is under the skin, the needle is slowly advanced while the plunger on the syringe is gently withdrawn. A flashback of dark venous blood into the syringe confirms entry of the tip of the needle into the lumen of the right internal jugular vein. The syringe is then removed and the guide wire is threaded through the needle into the internal jugular vein. The needle is then withdrawn, leaving the guide wire inside the vein. The blue object seen here is a dilator. The dilator is threaded over the guide wire and used to dilate a tract for the central venous line. The opening in the skin may not dilate well. To facilitate this, a small nick is made with a number 11 surgical knife. The dilator then passes easily. While compressing the cannulation site, the dilator is withdrawn over the guide wire. A 4-lumen central venous line prepared earlier is threaded over the guide wire and into place. The tip of a correctly sized and sited central venous line will sit in the right atrium in the region of the superior cavoatrial junction. With the line in place, the guide wire is withdrawn through it. Each of the 4 lumina is aspirated and flushed in turn. Each one then receives a 3-way tap and is made ready for connection to the various syringe drivers. One lumen is not connected to a syringe driver, but is instead connected to a central venous pressure monitoring line. This provides information that is vital for the conduct of the operation, as well as care of the patient in the immediate and early postoperative period. Once all of the lumina are patent and connected, the cannula is secured. Sutures are placed through 2 eyelets on the central venous line. The surrounding area is cleaned and the cannulation site is dressed.